International Brain Tumor Day. I would like to speak to you about the brain tumors and symptoms and signs that might be caused by the brain tumors. Brain tumors, in simple words, it's abnormal growth of the brain cells or from the layer that covering the brain inside the skull. It causes mass effect and affect the surrounding brain tissue and also destroying the brain tissue and cause symptoms. I will tell you about some of the clinical features, the symptoms and signs that brain tumor might cause. And if you have any of these features, then you might need to check with your doctor to find out if you need brain imaging to make sure that you don't have a brain tumor. One of the most important clinical features is having a severe headache, especially if it's a new headache and not resolving. Progressive headache, a headache that's associated with nausea and vomiting, especially if the headache is waking you up from sleep, or if the headache is more severe early in the morning. Other symptoms that might be caused by brain tumors is a seizure. Seizure might cause loss of consciousness or jerky movement of your arms or legs, or altered sensation of your arms or legs. Other features that you should be aware of is difficulty in walking, weakness in arms or legs, weakness on your extremities in general. If you have difficulty with your memory, especially if you're a young person, if there is difficulty with the concentration sometimes and performing daily activities, and in some cases, if the brain tumor is large enough, it might cause drowsiness or sleepiness for the patient. So these are in general the features that everybody should know about. In case if you have any of them that's not resolving or persistent, then you need to have a checkup. Thank you very much and have a good day.
So brain tumors in children and adults vary in how easy it is for us to cure and how easy they are for us to treat. The children's brain tumors nowadays, we aim to remove the whole tumor if we can by surgical removal using special equipment. Whereas in adults, it's much more difficult to treat some of these patients, and the outcomes sometimes are not quite so good. So in children, we see about 2 children every 100,000 children coming through with new brain tumors every year. So at our hospital, we see the whole range of different types of tumors, and in each case we try to remove the whole thing if we possibly can and give the best chance of cure. The outcomes have improved enormously in childhood brain tumors from how they were many years ago. And they do depend on largely on early diagnosis. So any symptoms such as headaches, vomiting, difficulty walking or seeing, vision, those kind of symptoms that have been persisting for a number of weeks, you should, as a parent, you should always take your child for a checkup and a scan. The earlier the diagnosis, the better the outcome. But outcomes generally have improved a lot over the last 30 years, and I expect things to continue to improve over the next 10 years with better technology, better computer guidance and everything else.
السلام عليكم. يصادف اليوم العالمي للأورام الدماغية، وبهذه المناسبة أود أن أتقدم إليكم بالدعاء أن يجنبكم الله هذه الأمراض. بالنسبة للأورام الدماغية في الأطفال، هي من أشهر الأورام التي تصادفنا في عالم الأطفال، فهي الثانية بعد أورام الدم. لحسن الحظ أن الأورام الدماغية معظمها قابلة للعلاج، وسواء بالجراحة لحالها أو بالجراحة زائد العلاج الإشعاعي أو العلاج الكيماوي. عندما تلاحظ بعض الأعراض التي سأذكرها على طفلك، يفضل أن تراجع أقرب مستشفى متخصص بهذه الأمور حتى يتم اكتشاف الأورام مبكرا وعلاجها بطريقة صحيحة. الإمكانيات الحديثة المتوفرة تسهل كثير مثل هذه التدخلات الجراحية كجهاز الميكروسكوب أو المنظار والأجهزة الملاحة أو النافيجيشن، عندما يعاني الطفل من أعراض تشمل تضخم في حجم الرأس أو صعوبة في النظر أو ضعف في الأطراف أو صداع أو استفراغ، يفضل أن تراجع أقرب مركز متخصص فيك ليتم التشخيص والعلاج المبكر. وسلامتكم. شكرا.